Thank you very much. Please be seated. Before I start, just two things. The first one is that we have decided to honor Dr. Gustav. So I want Dr. Gloria Maimela, just brief, and then we do the award. Come to the stage. Please, yes. Just a brief CV.
Yeah. Thank you very much, ladies, and thank you, His Excellency, Deputy President. It is such an honor and a privilege for me to share this award, just to acknowledge my mentor, my coach, the founder of the Foundation for Professional Development, Dr. Gustav Wolvaardt, whose career reflects a rare combination of clinical excellence, global diplomacy, institutional leadership, and an unwavering commitment to public health system strengthening. He, Dr. Gustav, at a point, defining moment of our nation's history, following apartheid, he served as South Africa's first health attaché in Geneva. In his role, he was entrusted with rebuilding South Africa's national health relationship and re-establishing the country as a constructive partner. He has led the established, he was involved in the establishment of UNAIDS, and also he's played a role in advancing the World Health Assembly resolution that formally recognized violence as a major global public health issue. He founded FPD in 1997 and has been there at the helm for over 30 years, and FPD has been significant in advancing public health in South Africa. In conclusion, I just want to say Dr. Gustav Wolvaardt stands as a pioneer of modern public health in South Africa, a leader who understood early on that sustainable change requires investment in people, institutions, and systems. His life work has helped shape a generation of health professionals, strengthen national and regional responses to TB and HIV, position South Africa as a leader in global health. And we honor him today. We recognize not only his achievements, but the enduring impact of his vision, a vision of equitable, resilient, and people-centered health systems. Dr. Gustav Wolvaardt, to the stage, please. Can we just start?
Okay, the second issue, Dr. Joe Phaahla has an engagement at 10 to 1. He has to chair an international conference. So I wanted to say, in case I'm not done, by that time, please sneak out. It might take a bit longer. Not too long, though. Thank you very much, firstly, to the conference chairs, Dr. Nkateko Mkondo and Professor Jackson Marakalala. Greetings once more to our Minister, Deputy Minister of Health, Dr. Joe Phaahla, who I had the honor to work with a number of times, including when I was the Minister of Arts and Culture. He was the Deputy Minister there. Deputy Minister Hendricks of Social Development is also here with us. Dr. Gustav, once again, congratulations to you for the work that you have been doing. Let me also recognize in our midst Dr. Gloria Maimela, Mr. Solinduku, my co-chair in SANAC, Dr. Tsepo Sidibe, representing SANAC Private Sector Forum, Dr. Tembisile Tulu, SANAC CEO. I didn't see her though, whether she's probably has left already. Leadership of the Rasingwe board present here, MECs and MMCs who may be present here with us, leaders of civil society, business development partners, but more importantly, you esteemed delegates from South Africa and all over the world. And greetings to all fellow South Africans. In their absence, I would like to express our gratitude to Premier of Gauteng, Panyaza Lusufi, and the host mayor, Mr. Nkosi Ndipendile Kagaza, for graciously hosting us in this city of Ekurhuleni. Equally, we thank Deputy Minister Joe Phaahla, whose stewardship and steadfastness continues to inspire our collective fight against TB, and Dr. Aaron Motsoaledi, our Minister of Health, for officially opening this conference on Monday. I fully agree with Minister's sentiments that ending tuberculosis, TB, in our lifetime is not impossible, and that it requires solidarity, dedication, and commitment from all of us. In the mid-2000s, specifically between 2006 and 2008, the country experienced a significant TB epidemic, further aggravated by a growing HIV crisis. Subsequently, in the year 2008, government researchers and civil society resolved to end fragmentation and work as one, recognizing that TB could not be tackled in isolation from HIV, poverty, and systemic health challenges. At that time, a shift began towards a more integrated response, leading to innovations like joint TB-HIV strategies and community-based care models, culminating in the National Strategic Plan for HIV, TB, and STIs. Now in 2026, the conference theme, VUGA, Let's Unite Towards TB-Free World, called us to rekindle that spirit of unity. Our history in the response to HIV and TB reminds us that disjointed responses prolong epidemics, while collective action bends the curve of history. The progress since the integration of our TB-HIV strategies, community-driven care, and innovation in diagnostic and treatment proves that unity delivers results. Thus, in 2026, this 2026 conference serves as a call for renewal and a call to rise together across nations and sectors to march towards a TB-free world. Yet, even as we gather in unity, we must confront the stark truth that South Africa consistently ranks amongst the top 8 countries globally for absolute TB incidence and stands first in the world when adjusted for population size. At the start of this conference on Monday, the Minister of Health, Dr. Aaron Motsoaledi, comprehensively outlined the magnitude of our country's TB burden. And indeed, the picture does not look good. Nevertheless, as a country, we have gained momentum in our fight against TB by strengthening systems and embracing innovation and technology. As you have heard during the conference, this momentum is real. Since 2015, South Africa has achieved a 61% reduction in TB incidence, surpassing the World Health Organization's 2025 milestone ahead of time. Cases have declined from over 500,000 in 2015 to around 249,000 in 2024. This is proof of strong political commitment, scientific innovation, and the resilience of our communities. However, progress on TB mortality has been slow, with only 17% drop since 2015, far short of the 50% target. This disparity serves as a harsh reminder that incidence reduction alone is insufficient to achieve triumph. Lives must be saved, households must be protected, and dignity must be restored. South Africa's response to TB continues to evolve with purpose and determination, underpinned by a strong multisectoral foundation led by SANAC, which coordinates efforts across government, civil society, the private sector, and other partners to strengthen prevention, diagnosis, treatment, and accountability mechanisms. The next phase of the response must build on this momentum by leveraging strategic information, innovation, and integrated service delivery to break down barriers to access and ensure that interventions reach the most vulnerable in a timely and effective manner. This requires deliberate shift towards a more people-oriented or centered approach that prioritizes community engagement, strengthens system resilience, and ensures that leadership at all levels is held accountable for delivering measurable impact in the drive to end TB as a public health threat. This conference has highlighted the importance of strengthening prevention, closing diagnostic gaps, improving treatment outcomes, and addressing the social and economic drivers of TB. It has also reinforced the need for a stronger accountability mechanism so that commitments made must translate into measurable impact at a community level. South Africa continues to demonstrate strong leadership in the fight against TB, driven by evidence-based interventions, but also data-driven responses. One of the key milestones in our response has been the launch of our TB data dashboard, which is accessible to the public. This platform enables more targeted interventions, strengthens data-driven decision-making, and also fosters transparency by making critical information accessible to all stakeholders. At the same time, South Africa remains at the forefront globally, among the first countries to adopt new and faster diagnostic technologies. This has significantly improved our ability to detect TB early and respond more effectively. We have also seen rapid uptake of new tools and innovations across the TB program. We have introduced service delivery innovations such as targeted universal TB testing, ensuring that high-risk groups, including TB contacts and people living with HIV, are routinely tested regardless of symptoms. We therefore also take this opportunity to thank and acknowledge all researchers who continue to lead on the innovation front. We welcome and strongly agree with Professor Paul Mashatile when he said, we have to embrace innovation and that we must collaborate more as the various institutions in the work that we do. Importantly, our commitment extends beyond treatment and diagnosis. At the United Nations High-Level Meeting on TB, South Africa reaffirmed its pledge to implement TB vaccines as soon as they become available. Program directors, this commitment is coupled with a recognition that ending TB requires addressing its root causes, including poverty, gender inequality, and the need for greater education on the TB epidemic. Together, these efforts reflect a comprehensive and forward-looking response, one that not only tackles disease itself, but also the conditions that allows it to persist. The End TB plan by the Department of Health outlines priorities, activities, monitoring frameworks, stakeholder roles, and targets over a defined period. It emphasizes integration with HIV programs, primary health care, and TB in the mines as well. It builds on broader national strategic plan for HIV, TB, and STIs, the NSP 2023 to 2028. The TB recovery plan and the World Health Organization's global End TB strategy. It further aims to accelerate progress towards ending TB as a public health threat by 2035, with an intensified focus on prevention, early detection, treatment, and addressing social determinants. Minister Motsoaledi presented the pillars of the plan to you, I believe, during the opening plenary, and made a clarion call for all stakeholders and individuals to play their part in ending TB. TB control is indeed everyone's responsibility. And some of the issues I believe he would have emphasized would be the following: that government leadership must provide policy direction and resources. Secondly, health workers must be equipped with tools, training, and support. Thirdly, researchers must continue advancing scalable innovation. Fourth, development partners and the private sector must provide support and align with national interest and priorities. And fifth, communities themselves must remain active partners, not afterthoughts. Let us ensure that collaboration is not just a word, but a working model. Let us make accountability a lived experience or practice. Therefore, as we walk away from here, I call on all stakeholders to commit to the following: 10 recommendations into concrete plans with clear responsibilities and timelines. 2, strengthen TB service delivery at all levels. 3, address barriers to care, including stigma and human resource constraints. 4th, improve TB HIV integration. 5th, prioritize prevention through accelerated and non-traditional screening, early treatment, and improved awareness. And 6th, support implementation research to ensure what works is scaled faster and wider. Program directors, at all times, remember that these conferences are valuable in fostering a shared vision. However, the true measure of success is what happens after the sessions end. Even as we acknowledge at the outset the heavy burden of TB in our nation, today we close with a renewed sense of hope and determination. Let us leave this conference inspired by our achievements rather than what is left to be done. The unity we have fostered across government, civil society, the private sector, and communities demonstrate that we can shape a future rooted in justice and health. Fellow delegates, TB is preventable, it's curable, and is beatable. Each advancement confirms that the pursuit of a TB-free world is a tangible reality we are actively creating today. Vuga, let's unite towards a TB-free world. Therefore, with unity of purpose and resolve, and in my capacity as the chairperson of the South African National AIDS Council, it is my honor now to declare the 9th SATB conference officially closed. I wish everyone safe travels home. May the unity and determination that guided our discussion during this week continue to inspire your future work. Carry the renewed hope that together we can end TB. Lastly, on your behalf, I wish Bafana Bafana well as they play Mexico this evening. So, Ekasi, they say, Siavena. Thank you very much.